More and more children are opting for weight loss surgery to help them shed their pounds. Lucille Packard Children's Hospital has performed 20 procedures. Well, this afternoon, NBC 11's medical reporter Marianne Favreau introduces us to one of them, a 17-year-old girl from Aptos.
For years, Kylie Crovo says she's hidden in the shadows, wearing dark clothing, talking to few people, and studying independently to finish high school, all because of her weight.
Right now I weigh about 256.
The 17-year-old started putting on pounds in 8th grade and has endured tough teasing ever since.
There was a point where Kylie refused to go to school. It was just too emotionally of a struggle for her to go and just put up with the ridicule and the pressure from the other kids.
That was really hurt.
Being obese also forced her to cope with some very adult health problems. Kylie suffered from sleep apnea, severe headaches, and a condition affecting the fluid in her brain that compromised her vision.
Ready? Come on, let's go.
Sure, she tried losing weight on her own.
I tried Weight Watchers, low carb, low calorie, low sugar, and tried to go on my own little diets. I'd write my own exercise logs, and I can't stick to them, or they just, I get bored of them, or they just don't work for me.
So Kylie decided to have gastric bypass surgery at Lucille Packard Children's Hospital.
We take the stomach and we make a much smaller pouch out of it, so it doesn't accommodate nearly as much food as our normal stomachs would.
Kylie was in surgery about 2 hours. Risks of the procedure include blood clots, infection, even death. 1 day later,
I feel really sore.
but Kylie is still able to get up and walk around the hospital. She knows the hard work is only beginning. She'll have to completely change her diet, exercise, and be diligent about taking vitamins and supplements if she truly wants to transform her body. We caught up with Kylie 9 months after she was released from the hospital. When we come back, see what she looks like now.
It has now been 9 months since Kylie Crovo had gastric bypass surgery. But was it worth it? Marianne Favreau caught up with her to find out.
Ready? Come on.
When we met Kylie Crovo, she weighed 256 pounds. That was just days before she underwent gastric bypass surgery at Lucille Packard Children's Hospital. During the procedure, doctors downsized her stomach to the size of a small avocado. Now, 9 months later and 107 pounds lighter, you'll find Kylie at the beach, a place she wouldn't dare go before.
It was definitely worth it for me.
She's thrilled to pack away these pants and finally shop for clothes at the mall. She feels better, too. No more migraines or sleep apnea.
All my health problems, I don't have to worry about them anymore.
But she wants you to know shrinking from size 26 to 6 has been hard work.
I've been told that's oh, well, you're taking the easy way out. It's not an easy way out. It's not easy at all.
Kylie's had to completely change the way she eats. Instead of her usual Big Mac and fries, she now orders a salad and only eats half. And that's how it'll be the rest of her life. Palm-sized meals, no desserts, and little fat. She physically can't handle more, so when she did eat a burger, she experienced painful stomach cramps.
Me and the bathroom became best friends.
Every day, Kylie must manage an alphabet soup of vitamins.
Okay, it's time to take my B vitamin, it's time to take my iron and my multivitamin. Halfway through the day, I have to remember to take my B12.
Kylie's surgery is considered irreversible, and she's okay with that. So is her father, who says his daughter is happier now than ever before.
Biggest thing I saw was just confidence in herself, just a lot more outgoing, a lot more active, spends a lot more time outside the house.
Kylie says not only does she see herself differently, others do too.
I'm just happy that I'm treated better now.
As a 17-year-old enjoys her journey down a new, healthier path, she says finally she no longer feels invisible. Before she could have this surgery, Kylie had to first participate in a doctor-supervised weight loss program for at least 6 months. She also had to agree to stick to a strict diet and exercise program after surgery. So this was really a big commitment and a lifelong commitment as well.
That is dramatic weight loss there, but are there any other concerns children should have if they've had this type of surgery?
Absolutely. One of the big concerns is that kids really have to be monitored for nutrients because they're still developing and they really need to get all those nutrients, which they may not get when their stomach is smaller. Also, the youngest age that Lucille Packard performed this surgery on was a patient who was only 14 years old.
And like she said, Kylie said, it's not a cure-all, it's a lifelong habit she has to have from now on.
It certainly is.
All right, thanks, Miriam.